digluma xamal la ni jar na ko xibaar bi ma la andil covid-19 mooy corona virus lépp la àdduna li ma jaaxal nag ci moom mooy xàmmeewul bu rek baatoo la tax docteur yi ci àdduna ñoom ñëpp a jóg nañu ànd ak ñun ngir yéex leen ba jàngoro ji jóg fii ci suñu askan leen Gambia Red Cross Society ñi ay ñoom yónni woon te ma xamal leen ne wéru askan wi moo leen tax a jóg àdduna wërngal képp la doon seetu suñuy vision suñuy yaakaar ñu wekkoon ko ci yow andi looñu lu dul covid-19 yow 2020 digluma xamal la ni jar na ko xibaar bi ma la andil covid-19 mooy corona virus lëmbe na àdduna li ma jaaxal nag ci moom mooy xàmmeewul bu rek baatoo la ndax docteur yi ci àdduna ñoom ñëpp a jóg nañu ànd ak ñun ngir xeex leen ba jàngoro ji jóg fii ci suñu askan yee ITC ñooy International Trading Center ñoo ne ma ni may yëgal leen ne wéru askan wi moo leen tax a jóg àdduna wërgal képp la doon seetu suñuy vision suñuy yaakaar ñu wekkoon ko ci yow andi looñu lu dul covid-19 yow 2020 tas na suñu yaakaar billaay tas na suñu yaakaar déglu leen ma man te ma joxe tegtal yi ci diitu ñu raxas loxo yi mu set te ñu moytu joxante loxo set fa wóorul moo la ca moytu ndaje mbooloo dafa wóorul askan wi nañu saytu ndaw réew mi te ñu diir leen ci biir kër yi ñu bañ a génn déglu leen ma jubtal si soldaar yi ci xeex bi déglu leen ma jubtal si soldaar yi ci xeex bi Red Cross jàmbaar ngeen yéen a ngi ci xeex jàmbaar ngeen yéen a ngi ci xeex bi yàlla tekki ñu tiis fi yaay borom
Good evening and welcome back on the COVID Gambia platform. We are back again to present to you, to give an update and to hold discussion regarding the COVID-19 situation in the country. I'll just allow some few more people to join in, and my co-host also should be joining shortly. So I'll just allow some few more people to join in before we start updating you and also discussing. As I always say, feel free to send us your questions in the comment sections. As we are going, we will be responding to the best of our ability. So just feel free to please leave your comments, your questions in the comment sections. And as we go, we will be responding. For those who are joining us newly here today, we are COVID Gambia. COVID Gambia is a platform of concerned citizens that have just put their different skill set together to try and come up with something as a way of contributing towards disseminating information, among other activities, disseminating information regarding COVID-19 in the Gambia in a way of helping the population get well informed and also receive beneficial information that will help in the prevention of COVID-19. So this is what we try to do every other day, so to say. We try to come live after compiling different information, different relevant information that we always take our time to verify and confirm. We then come live to present to you what the situation of the COVID is in the country. I'll just give a few minutes to my colleague, my co-host, to join me on this live before we start with the to update you with the figures of the day. She should be here very shortly. We'll start, and I'm sure that she will be joining me along the way. She should be here shortly. We'll start with the update regarding the figures of the day that have been compiled, and as we've been telling you, these figures are I won't say outdated, but they are 2 days behind. These are the figures that have been released today, but they are dated 2 days behind. Let me just bring them out. Yeah, the situation report of the health ministry that we've received this morning states that the current number of positive cases in the country as of as of August 19, which is today, are of 172. 172 positive cases have been recorded on the 17th of August and have been released today. Today is the 20th of August, the 19th, sorry. So the figures have been recorded on the 17th and released on the 19th, which is today, meaning that the figures are just 2 days behind. We are expecting to receive the figures of yesterday and of today, probably tomorrow, since this is how the ministry has been operating so far, due to the time it takes to actually release the test results once the samples are collected, okay? So when it comes to the number of deaths, so far there is apparently 14 new deaths that have been registered by the health ministry. 14 new deaths that have been recorded by the health ministry. So 172 positive cases with 14 new deaths. 20 people have been discharged from the treatment centers, meaning that people are recovering. We are thankful for that people are actually recovering from this terrible virus, and that it's not everybody that dies out of it, like some people believe it. Having corona doesn't mean that people are actually going to die. Some people get the treatment and recover along the way. So there are still 1,776 people in the treatment center, meaning that there's still way above 1,000 people that are still dealing with this COVID and that are still receiving treatment as we speak. 302 people are still in quarantine, so the quarantine places still have people also that are awaiting their test results, so to say. So again, let's say that this report are 2 days behind, meaning that these are not the official number of today. These are the official numbers of the 17th of August and the 18th of August. And they have been published on the 19th of August and released to the public. My co-host has joined us, Manyenya Dambel. Thank you so much for being here again tonight. Thank you, thank you. Welcome.
Thank you for having me. Thank you for having me, Bintou. As always, it's a pleasure. Good evening to everybody watching, and thank you for joining us again. It's a pleasure. Bintou, I'm so sorry. I didn't make it on time, but what have I missed?
I've just announced the figures of the day, so it's okay. I mean, we've just announced the figures that have been released by the Health Ministry, the figures that are dated 20th of August, but are actually the figures of the 17th and the 18th and have been released today on the 20th. So those are the figures that I've just announced. And we will have an ASPA on board that will do the analysis of those figures and also the general analysis, I would say, of the situation surrounding these figures in a very, in a much more have been released today on.
Perfect.
Anas?
Hello.
Yes, thank you for being with us.
Bintou, hi, Manyenya. How are you doing, guys?
Hello, Anas. Welcome, welcome.
If you can just adjust your sound a little bit more.
Is it too far? Is it okay now?
Yeah. We can hear you, but from afar. If you can just adjust it a little bit.
Can you hear me now?
Yeah, we can hear you.
Okay, thank you. Perfect. Looking at the report, this is report number 122nd from the 17th of this month, which is 2 days behind. Few points I could raise from this report. According to the report, 3.4%, which means basically 3 out of every 100. It's the death ratio that the Ministry of Health have put on their report. In terms of the report, just some little bit of clarification. The report does state it's the 17th, but the number of deaths is actually between the 14th to the 17th. So it actually spans.
Thank you for that clarification. It's important to.
Yes, it actually spans between those dates. So it's not just for the 17th. So it's between the 14th and the 17th. In terms of the positive cases, you're looking at 33% positive cases. So out of the 524 tests that were carried out, 172 came back positive, meaning 33%. So we've seen a fluctuation of the positive cases fluctuating between 30% and 40%. Basically meaning between 3 and 4 out of every 10 test results come back positive. 20 people have been discharged from the treatment centers, bringing it to a total of 435. That 524 test results that I told you, these are test results from both the Ministry of Health and MRC. So remember, we have 2 labs that are currently testing in the Gambia. So this is the MRC and the lab for the Ministry of Health in Kotu.
Yeah, the Kotu lab, yeah.
Yes. 5 people have been taken into quarantine, discharging 14. So looking at the figures, if you go back the previous day and the report for the last 2 reports, you'll notice that there's a continuous decline in the number of total number of people being quarantined. My only take on that, looking at previous reports, the Ministry of Health have actually explained in one of the reports that the quarantine centers are not sustainable. So the continuous drop in the number of people being quarantined only gives one suggestion. Are they starting to draw back on that project because it's not sustainable? That is something that we need to find out from the Ministry of Health, because there's been a continuous decline in the number of people being taken into quarantine.
Yes, and that's a big cause of concern, actually, because when you see the figures rising, but less people in quarantine, I mean, this raises some question.
That's right. Looking at the report moving further, is actually, you would notice that all of the 7 regions now have got reported cases of the COVID-19.
Indeed, that's what we've noticed. So
all of the 7 regions. The biggest problem.
So what does that mean? Does that mean that the tests are being conducted now beyond the Greater Banjul area?
They've always been conducted beyond the Greater Banjul area, but what that possibly means, it's not actually possible. According to the report, it says now all the 7 regions, so the Western region, the upper region and so on, all the regions have actually had confirmed cases of the COVID.
Yes.
So if you move to Basse, in that area, there's been a confirmed case. If you move all the way to Koina, there's been confirmed cases in those regions. That's what it simply means. One of the biggest things that drew my attention on this report is actually, when you look at the report in terms of the cumulative number of cases, something drew my attention whereby I saw a figure 0 on contact tracing, and I think that's very important. I don't know why the 0 is actually there, whether it's actually 0, but it showed that there was 0 number of contact traces on this report, which is concerning. If the Ministry of Health are not tracing the contacts, who knows who they're infecting and who they're not. Yeah, so it's really important that the contact tracing is actually done. But in this report, I could see a figure of 0 there, so I'm not quite sure whether it's an error or it's actually the number.
We've noticed the 0 too, and I mean, this what this means is that if the 0 is actually accurate, it means that during that period, probably that no contact tracing exercise has been conducted, which is a big cause of concern, because how do you curb the spread of the virus if you do not isolate the contacts of the positive case that has been registered?
Mm-hmm. Absolutely, very important. Bintou, from the report generated the 1722nd, these are my observations from that.
Okay. All right. Well, we thank you, Anaspa. Thank you so much for
welcome.
This analysis. Yes, we will continue with the information coming from the Health Ministry regarding the 1025 number. We're still on it. Still try to confirm what the situation is. And according to a release from the Health Ministry, seems as the 1025 toll-free number are going to all mobile phone networks, Gamcell, QCell, AfriCell, and Comium. The public can continue using the 1025 to report or ask for information related to COVID-19. And the ministry is thanking the public for their patience and for their understanding of this situation. Yes, it is true that this 1025 has been going through issues, but it seems as if the authorities are coming to terms with these issues gradually, and that hopefully the number is now fully operational and is accessible from all these major telecommunication networks, as stated in this statement from the authorities. Manyenya?
Yeah, Bintou, the figures are, well, like what Anas was saying with regards to the contact tracing. That is so disappointing because we need to know what is happening with regards to that. But yeah, we have been looking at some stuff, Bintou, yourself and,
Yep.
I'm just going back to, okay, so there has been some news with regards to Canifing Hospital. According to the ministry, I believe they're changing, they're going to turn it into a COVID center. So they'll be treating mild cases, and also, is it going to be a test center as well, they said, or?
They've not specified. It's just going to be a treatment center, apparently, according to the release.
Yeah, so my thing is, yes, it's going to be a treatment center. We definitely need that. But if you look at the figures, because Serekunda is very much populated. Of course, if you look at the population of Serekunda at the moment, I believe it's about 340,000 people.
Mm-hmm.
So that hospital is gonna cater for the Serekunda region. And not only that, what's going to happen to those patients that when they fall ill, emergencies and that sort of thing? What are they going to do about those patients if you take that away from them as well?
Okay. That's a big cause of concern. I mean, that's the question that I asked myself instantly after reading this communique from the authorities. The first thing that strikes is like, where are all the other sick people going to turn to once they have something different from COVID, knowing how how crucial the Serekunda hospital is in the heart of Serekunda area all over. People come from different places to access this hospital. So if this hospital is turned out into a COVID treatment center, what happens to the other patients and the other sick people?
Yeah, because this shows you why we need to take our healthcare system very seriously.
Indeed.
Because if you look at the population of Serekunda, which is 340,000, you look at Brikama, which is 77,000 people, and then Banjul is 34,000. So we have got the RVTH, which is in Banjul, and then you've got the Serekunda, which would be the Talinding, Churchill Sound, Serekunda, those areas. They would be classed as the Serekunda area, wouldn't they? So they've got 340,000 people. So who's catering for the Brikama region, which has got 77,000? And I believe they've also mentioned that there has been most cases coming from that area there, from Brikama. Correct me if I'm wrong. So it's, yeah, and it's just when you look at the government budgets as well that has happened in the past year, you think, how come they haven't allocated at least some amount of money, and they could have built a hospital in Brikama?
Well, I mean, we know about the Brikama Health Center, but some of these hospitals, if you go through the different reports that are coming from the ground these days regarding health centers and other hospitals around the country, around different regions in the country, the situation, the condition of some of those hospitals is quite worrying, to say the least. There's also some reports coming from some of those health centers, especially around the Bansang area, stating that the nurses were not receiving their allowances, and they were excluded from these allowances, and they were really unhappy about that, obviously, and asking for answers, because they're also part of the healthcare workers that are already involved and fully involved and on the ground and constantly catering for the public, and especially during this COVID-19 period, the demand is higher on them. So when it comes to some of those hospitals, I mean, the facts are here. Some of them are not in the shape that can actually accommodate sick patients in a proper way and cater for COVID-19 patients. They've not been turned into proper facilities for that.
Well, apparently the tents that were being built at the Backhouse Stadium, they're going to have about 100 beds there, which is going to cater for COVID patients. And also, they are working closely, the Ministry of Health, they're working closely with WHO experts, and they've predicted that we're going to reach our peak the first week of September. So when we do that, what's going to happen, Bintou? Can the hospitals cater for what is about to happen? What is in place? I know we've got the Bakau 100 people, but if you look at the population in these areas, would it be able to cater for what's going to happen in September, and also cater for those people with conditions that can also affect their lives? They would need to be seeing the doctors, heart patients, cancer patients, emergencies. That has nothing to do with the virus. Indeed. So are we going to neglect those people and then focus on what's about to happen? We are so underprepared.
I mean, and I think, well, being underprepared is a reality. I mean, it's a reality. That's undeniable. But the fact that is quite worrying today is that this prediction states a high rise in the number of cases in a couple of weeks to come. Knowing that the healthcare is already quite overwhelmed with the current situation. The facility that we're talking about in Bakau at the stadium, that's a sort of covered pavilion somehow, but can it resist the rainy season? Because we cannot even, we can't forget the fact that we are in the middle of the rainy season at the moment, and that thing is an outdoor sort of pavilion, I want to say. So that's also another cause of concern. We're talking about 100 beds, but they're outdoor. They aren't indoors.
No, yeah. It is quite sometimes, like I always say, it's not about finger pointing and that sort of thing. But it is scary when you think of the population in these areas and you have just one hospital that is going to cater for those. Because anybody who has it in Brikama, they'll automatically want to come to the Canifing Hospital. So the Canifing Hospital is going to get overwhelmed. That's definitely for sure. And then the people who already have illnesses that needs to be looked after, those people are going to be neglected too. So I think we need to have more plans in place. I'm not sure what else the government is doing with regards to the fumigation, because I know they're doing the markets, and I know you've got the local councils who are trying to do their bit as well. But I think we have to do more than the markets, because at this present time, we've got malaria to deal with. I think we need to get streets being fumigated. I think we need to go outdoors and fumigate everywhere. That needs to be done, and it should not just be left on the KMCs and the Banjul City Councils to get that done. And the Red Cross, something needs to be done, because although we're underprepared, but we can do our utmost. We can do whatever it takes to make sure that we don't get overwhelmed. Because I don't even know if I should say this or not, has the Gambian healthcare system collapsed due to COVID? I ask myself that all the time. Has it collapsed? Is that a yes or a no? Having this Canifing Hospital is a good thing. Yeah, it's positive. It's a good thing. But then you think about if you have an uncle who has diabetes and goes to the hospital, or somebody who has an accident on the road and needs assistance. Because I saw a video that went viral not too long ago. Well, I saw it yesterday, actually. There was this woman in the middle of the road crying. Nobody could help him or help her. All they did was they had their cameras and they were filming her and just questioning her. She didn't even know what was wrong with her. She didn't have the symptoms, but they were scared to help her. So what is happening to those people? I believe, yes, COVID is real. We are trying to curb whatever else is going on. But we need to also not forget those other people who have other illnesses that need to be looked at. Because those people with the underlying issues, if they get ill or they get the virus, we know what that can do.
Yeah, well, I mean, healthcare, these healthcare issues are not anything new when it comes to the Gambia. It's always been a challenge. COVID came to add damage on injury, I would say. So the healthcare was already very fragile. The healthcare system, if we can call it that way, was already very fragile. So you add to that the COVID situation that comes impromptu, unannounced. All of a sudden, lots of restructuring has to be happening. It's quite worrying. Do we have the capacity? Are we prepared enough? I mean, there's lots of questions that we're asking ourselves. The authorities want to be quite reassuring, but I guess the general feeling among the population is a feeling of worry, because we are conscious of the situation of our healthcare facilities cross-country, I want to say, be it in the urban area or in the rural areas. I mean, the public hospitals have always been, it's always been quite a challenge to be able to access proper healthcare. So I want to say that we're in very difficult times.
I just hope this is a lesson to those in charge, that they need to build hospitals where it's necessary. For instance, imagine if we had a proper hospital in Brikama right now, who, according to what I've read so far, they've got the highest cases of the COVID. So we need to focus on things like that. Health
after Banjul, yeah.
After Banjul. So we need to focus on things like this, because you can't say much when it comes to things like this, because there's a thin line, basically. You know, you don't want it to seem like you're finger pointing, but Gambia's health system needs to be looked at. When we're putting
Indeed.
money on other stuff. Oh, sorry, I just saw something come up on the screen. When we're putting money on you know, other stuff, unnecessary stuff, we should be putting money, when we're looking at the budget, we should make sure, well, not, you know, the government should make sure that they're looking at the health system, the healthcare system of the Gambia. It's very
Indeed.
important. This
And
is
I mean,
a
you
huge
know,
lesson. It's a huge lesson. And it's not too late. It is not too late to make right what is wrong.
Indeed, and I mean, we can discuss about it. We should discuss about it. It's about time we stop discussing some of these things indoors. We need to have open discussions about these issues. Healthcare. I mean, what is a country without proper healthcare? It all starts from proper healthcare going forward, I believe. So if we refuse to have these open debates, or we feel like it might be an uneasy debate because some people might feel that we're pointing fingers. No, this is just a normal conversation that concerned people should be having regularly. And this is the only way we can actually improve on some of these deficiencies, I believe. So yes, there's nothing absolutely wrong in discussing these things and not being sentimental or personal about it.
Yeah, absolutely. I think we need to make sure that the government needs to listen to its people. And when it comes to the healthcare system in the Gambia, definitely it's not the people who have to tell you. You just need to see how things are, and then you understand. First, we spoke about how women were dying during child labor unnecessarily, and then we had other issues that you can't even. So you fight that you have to go to Senegal, for instance. And I can remember in the 80s when the Senegalese used to come to the Gambia to come and get healthcare, you know. Mm-hmm. So it's just the way things have changed. We need to look at what we have been doing wrong to try and make, change, do something about it. It is wrong. And I think what's happened with the COVID, it is a lesson learned. We need to make sure that we invest a lot. When you're doing budgets and you're putting money on things that are so not necessary, think about the healthcare system, because there might be another COVID in 30 years, 40 years to come. So, yeah, this is just, it's sad. Mm-hmm. It's really, really sad.
I mean, this, like you said, this should definitely be a wake-up call. This should be a wake-up call. I mean, this has highlighted the deficiencies in many areas that our country is dealing with. But we will continue. I mean, this discussion regarding the deficiency of the healthcare system in the country. But we need to move forward. We have other topics to also address.
Oh yeah, sure.
We have some few questions. Let's look at the question section and answer some few questions before we move on. So I have a question. Badara Saya, thank you so much for being here and for following us. So I have a question. Is the 1025 working? Well, we've just announced it, Badara. I think you probably have missed it. There was a release from the Health Ministry earlier today and also yesterday regarding the 1025 number, and I will read it for you again. You might have missed it. The Ministry of Health would like to inform the general public that all calls to 1025 toll-free number are going through on all mobile phone networks, namely Gamcell, QCell, Africell, and Comium. The public can continue using the 1025 to report or ask for information related to COVID-19. So meaning that, yes, according to this release, the 1025 is working. I'll challenge you, Badara, to please try and call the 1025 and confirm to us on this page if you've been able to access it. It's very important.
And what about the alternative numbers that they spoke about? Is that working too?
Well, they had announced some alternative numbers, but we've seen that post has been taken down. So I guess that now that the 1025 have been resolved, they probably want all the calls to go through the 1025.
Yeah. Selector Charles is saying that I think the Ministry of Health should conduct more fumigation to offices. There is hope as far as people are recovering. Huge thanks to the healthcare workers on the front line of the coronavirus pandemic. Thank you, Selector Charles. He's always here, so thank you for being on, for coming again. Thank you so much for your support, as always.
Thank you. Well,
I've got another one from Omar Njai. Omar is saying, COVID should be a wake-up call to give priority to our healthcare system. It's high time to have a hospital in Brikama.
Indeed.
I totally agree with that. I totally agree. So we should look at that, and I'm sure that, you know, like we always say, the government is watching, so they always listen to the people, which is quite good.
I mean, yeah, there's some areas that are considered central, you know. They are considered central, and you can't afford to not have a proper hospital in some of those areas. I mean, that is the basic in terms of building a community or building a town. That town, every town should be equipped with a proper hospital, actually.
Yeah.
So this is something that, and if the hospital is not in a good shape, it's about time to invest in rehabilitating some of those places. It's a must. We've seen the disaster that the COVID is causing and how overwhelmed. I mean, if we go to the extent of setting up in a stadium, it means that our actual hospital or healthcare facilities are not either up to standard or they are not equipped enough to be able to accommodate so many people. So this is a high cause of concern, and it has to be addressed, and hopefully something will be done about it going forward.
Yeah, Wala was saying something along those lines, saying that, you know, the hospitals definitely need to be equipped. Yes. Yeah, he just says building hospitals are good, but they need to be well equipped with the latest equipment, manned by well-trained professionals, and a governance system that accounts for integrated healthcare management on all fronts, but also have the basic amenities of a constant 24/7 supply of electricity and water. Currently, our healthcare system unfortunately lacks this, a sad state of affairs. I totally agree. I totally agree. We can't just build white
quite well, yeah.
Yes, we can't just build white elephants. We need to make sure that they're equipped with what they need to make sure that they're taking care of the citizens. Absolutely. Yeah. I agree. Thank you so much for that comment.
Yeah, that comment was a very, very important comment. And I think that this is something that we need to emphasize and re-emphasize, because having hospital is merely a structure, okay? But if those structures are not equipped with what is needed to really provide the right type of services and cater for the patient according to the different pathologies and sickness that they come with, what is the point of having the structure? So all that are things that I hope, and we hope collectively, that the ministry will be looking into going forward. Because right now, as we are running, and we've all been to the hospitals around the country, we see clearly what the situation is, and it's not a secret that we are really, really, really in a very sad state of affair when it comes to our healthcare system.
Absolutely, absolutely. It's not finger pointing; it's just constructive criticism.
Indeed, and indeed. I mean, and it's not even a critic. It's actually
fact.
It's actually a fact, and it's something that can be verified. We're not bringing to the public anything that is not verifiable. It's just a fact that we're discussing about, and this is the situation. And we truly hope that this COVID is going to be a wake-up call to the authorities to really, really invest money where it should definitely go to. Healthcare first and foremost.
Yeah, healthcare should always be priority. Healthcare, healthcare, healthcare. If we're not healthy, how are we going to get up and go to work? If you know that, you know, when accidents happen, you see, Bintou, seriously, let's not even go in. let's not even go into that, you know. But yeah, I think government needs to look at that. Healthcare is very important. It should be made priority. And when there's money allocated to healthcare, let's use it very wisely.
Indeed. We had one more question from Mama Aminata Jeba. Thank you for being here and for following us. Emergency numbers should be publicized widely and people can add it to their phones so they can easily call for assistance if the need arises. I think major cell phone companies should help with this. Well, I believe this is the idea going forward, and this 1025 emergency number, I know the authorities are working with the private sector and trying to really come up with something that will be really efficient going forward, because there's been so many negative press going around regarding this 1025 number, and I believe that the authorities are now taking it really seriously. And going forward, we might see some changes regarding access to this 1025, and also the collaboration of some telecom companies to really make the usage of this number much more effective.
But she's right. If you look at what she's saying, she's absolutely right. What's the point of having a number when people don't even know it exists? How many people know that this number exists? And plus everybody now, it's common knowledge for everyone because they're saying that the number doesn't work. What is the ministry doing to kind of let people know, apart from Facebook, because majority of the population aren't on Facebook. It's just a small minority of the population that's on Facebook. So the ones on the ground that don't know that it's working, the ones on the ground that don't know it exists, what are we doing to let those people know? What is being done? You can't just rely on the 2% that's on Facebook. We need to do more than that. So billboards as well. How many people are educated enough to look at a billboard and say, So we need to look at that as well. We need to make sure that the information is going out there, past Brikama into the rural areas, and they know what numbers to call just in case. Or are we just thinking that maybe those people might not have credit, or it's free, isn't it?
No, but,
so they need to push the information further beyond Brikama.
There is some sensitization that is being done on the ground, You have frontline workers, you have volunteers also that are taking part to this sensitization cross-country. You have teams that are deployed across the country, and their role is to sensitize people regarding this COVID and relay some information to communities that are quite remote or not really privy to some of this information that are being shared online. So that's also something that is existing, But I mean, there is obviously more and more sensitization that has to be done. And I know that the local radios are relaying information. And I know that in upcountry, lots of people rely on radios to access information. So I know that there's lots of information that's being relayed via the radios and in various languages, in all the local languages, and if you listen to the radio around in early hours of the morning, all the information that you hear is about COVID. So there are actions are being done on the ground, really, by different groups and different entities. But we can only increase on what is already being done, improve on it and increase the actions, not just 1025, but even Red Cross and the police. Like here, we can easily dial 911 to call the police. Absolutely. I mean, all these emergency numbers, people should really know them. And those numbers should be easily accessible also. And those numbers, there should be somebody answering to those numbers when people call also. Because right now, if you ask me the number for the ambulance, for example, if there's an emergency, this is not a number that has been widely publicized, If we find out, yes, right now I know what the number is, but after trying to find out, it's not a number that I came across really randomly or really easily. And some of those things are things that should be really easily accessible to the population. It should be dispatched cross-country to every member of the population, because an emergency can happen anywhere and at any time, and people should know what number to call at that instant. No sound. Manyenya, you might have muted yourself. Do you want to verify? Seems as you've either muted yourself or...
Can you hear me?
Yes, you're back.
Oh, I'm sorry. I've got the thing behind me. So, yeah. So, with regards to those numbers, I think they need to put focus on that, because what happened when we were young? You were saying not everybody knows the number, but for me, in the early 90s or whatever, we used to know all these numbers: fire brigade, the police, and things like that. We used to know all of these numbers, and they used to work. So what happened along the way? And at that time, we didn't have all these, we didn't have the Q cells and the Afri cells and mobiles and whatever else, so I don't know. I think that is something that the people at the top need to look at, to be honest. There's so much that needs to be done. And I feel hopeful. I feel hopeful in the sense that I think COVID would give them an opportunity to sit down and say, okay, fantastic. This is where we've gone wrong, and this is what we're going to do. And we're going to use that as a reference to make sure it doesn't happen again in the future. Hopefully that is what's going to happen, because people are dying.
The challenge is huge. Challenges,
absolutely.
Lots of reforms and lots of restructuring and lots of building and reconstructing to do. I mean, that's a fact, but it has to start from somewhere. So we hope that this after COVID will be really a wake-up call to everybody, be it the authorities and even the population, in really dealing with some of these questions really, really seriously. Yeah. We'll move on to another topic that is quite important also, is the issue of children during this COVID-19 period in the country. There's a release from the police that came out regarding parents. Parents are asked to keep their kids home or risk being held to account for failing to protect them from deadly disease. I mean, what do you have to say about that?
Well, I was speaking to a friend today just before I came on, and there's this thing about people thinking that the COVID will not affect children. It only affects older people and those with underlying issues. Well, I can tell you that is wrong. COVID dina rey ndaw, COVID dina rey mag, COVID dafa rey halel. COVID ñëpp la moo rey soo infected te yaa ngi am jàngoro boo yaa ngi feebaroon am feebar boo xam ne comme nañ ne diabetes nga amoon or heart disease or cancer or whatever, am nga chance pour COVID bi rey la. Waaye not because ne danga nekk xaleel tamit COVID mun na la dara de. COVID tamit mun na laa rey, mu ngi rey ay xaleel, mu ngi rey ay mag. So parents yi ñu ngi leen di ñaan ngir yàlla ak yónnente bi ngeen téye seen doom yi si kër yi. Na xale yi nekk foofu di let them get the kids, the kids need to be occupied. I think it just saddens me when the police has to put something out there to tell parents to look after their kids. This is a pandemic. This is a serious situation that we're in. And you're telling me that adults don't know any better? It's just sad. We come from 1 minute we're talking about, sorry Bintou, we come from a minute ago, we're talking about the government and their responsibility, and this is where individual responsibility too comes in. You can't just be pointing the finger on one direction and you're not thinking about yourself and what your responsibility is as a parent, as a citizen, as a brother, as a sister, as a neighbor. We all have individual responsibilities. Because the more we don't listen to the government, we're going to make it difficult for them. It has to be a collective effort. It has to be, or else this is going to get worse. Do people understand? Have they gone out there and sensitized people in the local languages so they understand what it means for it to peak? Do they understand that? And do they understand when it peaks in countries where Nyomsen healthcare system is good, how they are like crying like babies because they can't do much? Did they see what happened in New York? New York is not a third world country. It's not in a third world country, but it was bad. So now imagine Gambia.
Like you said, go ahead. Lots of people, I mean, there's lots of misinformation also. And if we don't deconstruct all those misinformation, it can cause a huge damage in this small society, okay? Lots of people believe that COVID affect. It's misinformation, it's misconception. There have been rumors going around social media, WhatsApp audios, and that's what those videos, that's the message that they are relaying, that COVID, kids are spared, it's just adults that are going to, that can catch the virus and can suffer from it or can die of it, you know? So this is something that obviously, that's an information that has to be deconstructed in people's mind. That you also have those that still do not believe in the existence of the COVID because they believe that, they always say that seeing is believing. We've never seen somebody who had COVID and has been suffering or has been in the treatment center and has been under respiratory distress or anything like that. So we can't really believe that COVID is real. It's all that is political. You have lots of people who believe that all that is political and it's here to disturb us. It has disturbed our businesses and our activities, and it has to end. This drama has to come to an end. They still do not believe in the existence of COVID. So how do you make sure that those people actually hold their kids at home when themselves as adults do not actually believe in the existence of COVID? You see some people that are still sending their kids, their young kids, without a mask. Not later than today, I've seen some kids selling fruits in the streets. They had no mask on. And these are school-age children.
And also
it doesn't mean that parents should be sending their kids out in the streets, roaming about without any protection, you know. So these are what the authorities are trying to address also. And just like you said, this is an individual responsibility. This is individual responsibility. How I take care of my children at home because I'm conscious of the reality of COVID. It is also my duty to talk to my next door neighbor about the importance of keeping her kids at home to make sure that the kids are not exposed to this virus.
Yes, absolutely, Bintou. And, you know, where are these posted located? You know, you can't go to Fajara or basically, the point I'm trying to make, like you said, you saw some kids, they're selling fruits. Where do those kids come from? Poor families. Go to the areas where those people might not have a mobile phone to be watching COVID Gambia. Go to the areas where those people aren't as much educated or whatever, and sensitize those people. Because I don't think Bintou Kamara would let your kids start roaming on the streets. You cannot sensitize those people who already know what they're doing. Do you know what I mean? Because they're watching the news, they have access to the news, they have access to Facebook, they have access to all of these things. So just putting a big billboard, Bintou, telling you about COVID, do you even read it? Because you're already sensitizing yourself, you know. But go to these areas where these individuals hit the jangun. Maybe they don't pay attention to these things. They don't have access to electricity is a problem la punyom. Those are the people you need to go and sensitize. Those are the people who need to know what is going on.
There's also the economic aspect of the situation also. Lots of families are suffering. They face very serious challenges in trying to feed their families, you know. Some of them, that's what they do to sustain their families. That's what they do to be able to feed their children at home. By sending their kids to sell some fruits, they actually can bring an income for the next day meal. So all of a sudden COVID happens, and then you ask those people to stay at home, to not go to the markets, or to go to the markets at very fixed hours when they will probably sell half of quarter of what they used to sell on daily basis. Their children are not allowed to go and sell the fruits or wait for them in their canteen when they are away or something like that, meaning that they cannot just sell as they used to. And on top of that, they have their families to feed. How does that happen? The government has not provided any stimulus package for these poor families apart from the rice distribution. And we heard that the rice distribution has not been going according to plans. I mean, lots of families that should have benefited from those packages have still up to date not received any of those packages. So it's a big challenge, because if the authorities ask people to actually remain home, sit at home as much as possible, and respect all the measures, they will not die of hunger. Also, some people would just defy all those measures to make sure that they feed their families. So that should also be looked into really seriously.
Absolutely. Bintou, this is what I call a ping pong of responsibility. Because in a minute ago, or 10 minutes ago, we were talking about the government building hospitals and all these type of things. And then we were like, okay, the people too need to make sure that they're staying at home and doing what they have to do. And then you come and realize, hang on a minute, how are they going to get fed? So it goes back to the government. Government, now what are you going to do? So it's just going back and forth. And I think the government has to take majority of the responsibility, to be honest. There are poor families out there. You've given them a bag of rice. Where's the fish? Where's the oil? They will go and find oil and fish. So they have to find an incentive that is going to keep those poor families at home. They have to find something to do.
Yep.
You know, you cannot tell somebody who depends on going out there and selling something to get money to go to the market to come and feed their children, telling them, no, you need to stay there. Most of those kids, maybe the reason why they're coming out there to sell, maybe their parents are ill or something is wrong with them, and they're putting their lives at risk. So that goes back to the government to say, what is it are they going to do to make sure those kids are staying at home? Because you can't just ask people to stay at home and you don't know what their circumstances are.
It's complicated.
It's so complicated. Seriously. Do they ham safan ga wara wahe?
No, it's quite complicated. Yeah.
1 minute nga toga ne okay ni jël len sen def len lolé wara def then nga togal rek xalat ne okay why government bi tamit war nañu def li, you know? I don't know. I don't have the answers. And the people who have the answers, they're at the top. Ñom ñoo xam naka la ban xaalis lañ am ak fan lañ ko mëna dugal ñun xamuñ. We can only make, we can only assume, and also just man dal dama xamut sax. Seriously, sometimes
I mean, for the benefit of the non-English speakers, we will just summarize a little bit what we've been saying in Wolof and in Mandinka. What we were just addressing right now, Nkamenka cha sainte wole kumakong membota ng polisol la Carola iko kadiamu alfa le meni alon ko ke dingol tumbe dol kan dingol bita dol bi ka wafirola dol bi be yailam be dol kan ni corona jamano kono andun corona be kirinne molia kala mutala ka be kirinne sai alfa me alon ko yedingo tu yaila smbe do kan wala ya tarafiro la silol kan tari akamta ko itala alfa la responsibility wala nyinti ko nyanta maro men kala ila dimba me san law wato kono imata manda nyama ini masakunda be lafla problem mo sotola so ko momo teta alfa ti nyanta ila dimba mutala suwo kono le ila dindingol amanke ko karamungol soronta le nyanta ibula la ko adiate nyame be tara yaila silol kan nyanta mara la suwo kono le fo janni menin ko Kenya lonna ka to sa be dame courant ni wajabita banko kanne andun dindingol man tanka ni courant wala ni courant ka kebal mala aka dindingol mala wala tinna iko momo yedingol muta suwo kono idingol kana tara yaila silol kan andu kana tara firo la dlal to tarin fana katunga dol jele men yalon ko bi fon ngadindin dol jele be silol kay be wafiro la hana mask fon man tarela andu yalon firla ini moja mala kabe so sa wodindi ngoni abe bulo dunna mol bulo abe kodo mutala mol bulo mol bina nakilala mask fon man tarala ha andu modindi ngona e kura ngoni tambe do ka ba sambalete na suwo kono la fele ila korda mume be corona so. Manya, you can just go ahead with the Wolof version of that story, please.
Okay. lu Bintou doon wax ci soose mooy ne police yi ñu ngi génnee statement boo xam ne ñu ngi wax ne am na ay kilifa yoo xam ne ñu ngi am seen doom yi ñu ngi génn ci mbedd bi ba léegi dafa am ci ay xale yoo xam ne tamit xëy na ñu ngi dem di jaay am na xale yoo xam ne tamit xëy na dañoo génn rek pour fo ñu ngi ñaan yaay yi ak papa yi képp parent boo xam ne yaa ngi déglu lii ngeen téye seen doom yi ci seen biir kër yi because feebar bi dafa nekk feebar boo xam ne du ne rek mag rek la moo laal te du ne rek ñu feebar ñi la moo laal dina laal xaleel tamit te xale yi tamit ñoom tamit dañ dee sonna su lañ talee soo ngeen bàyyi seen doom yi xel bu leen bàyyi seen doom yi ñuy génn nekk ci mbedda bi te su dee seen doom yi dañu war a génn ñu ànd ak mag o ngeen make sure tamit ne ñu ngi sol masque bi du pour mag yi rek xale yi tamit war nañoo sol masque ngeen bàyyi seen xel ngeen bàyyi seen xel because jàngoro bi dafa nekk loo xam ne ñu ngi wax ne su weer bi deeyee ci first week in September ci la jàngoro bi ci la yëfi di gën a métti ci réewi Gambia soo léegi bàyyi leen seen xel ngeen téye seen doom yi seen kër yi toppatoo leen seen doom yi ngeen protect seen boppa because fu mu nekk nii képp koo xam ne yow citizen nga ci biir réew mi war ngaa jël individual responsibility loolu mooy lan mooy ne nga make sure ne yaa ngi sol sa masque yaa ngi déglu lu ministre bi di wax ne moom nga war a def ngay raxas sa loxo te ngay toog sa kër te toog sa kër du yow rek bàyyi leen di bàyyi seen doom yi ñuy génn ci biti ci mbedda bi di foyi te doo leen xam fuñ dugga because saa yu gaay génnee ñu am feebar suñ ko indee ci biir kër gi lañ ko indi yow yi tamit mun nga koo am soo ñu bàyyi suñ xel.
Yep, this is it. And there was an information that came from the MRC also. If you remember, sometime last week, we had announced that MRC was closing for the public. I think they went through some fumigation exercise and different adjustments to really be able to receive the public in a better way, in a more secured way. So it seems as if that has taken place and that the MRC is now back in service for the public. So they will start, they have resumed their services to the public, and the access will be at their gate in Fajara, and the opening hours will be from Monday to Friday, and as usual, it's like from first come, first served basis. Yes, exactly. So this is what the information that came from the MRC, and they're also stating that obviously people should make sure that they wash their hands at the entrance. I believe that water and the necessary soap and will be provided at the entrance of the MRC, and nobody would be allowed without a mask also. So you should make sure that you wear your mask. Nga kibaro ni mefo angale kangola sainte wala nyinti ko MRC komanto domandi akamta ko ni lokun tambila yela bundal soron pour molmen kataje kata jaral nyinola ila dinkira nyinto sai akamta ko ye bundal nyil yelele kotenke kabo tenengola kata fo jumalungo ila bundal be kala yellale wala ila nyim bundati memba fajara akamta ko mol men yalon ko isula tatala MRC o wato ko no isita no jele ila bundal ka yelele somanda juno mol kata jele ka to nimme folo futata ka wala ta MRC la system o be wala nyam bari men fo wala nyinti ko momo bitaje fanan bulku o mu farlol ti bundato anin mote dunna ni atara masko mantare bulu ita sonne yedum ni bita MRC inyante fankantala maskola le anu jannibe dunna fanan inyante bulo kulal.
Lu Bintou doon wax ci soose mooy ne MRC ñu ngi tëjoon seen bunta yi because ñoom tamit foogoon naa ne amoon nañ seen ay liggéeykat yoo xam ne gars yi feebaroon nañ waaye fumigate nañ mooy ne def spray nañ foofu yëpp pour mun a rey jàngoro bi so léegi gars yi ubbi nañ waat seen bunta yi so ñu ngi ñoo joxaat a second chance ndax du Bintou so ñu ngi joxe waat second chance nit ñi léegi mun ngeen a dooraat di ñëw waaye boo leen ñëwee ba ngeen egg ci bunti MRC bi make leen sure ne yéen a ngi amee seen masque te raxas ngeen seen loxo parce que soo defutee loolu duñ leen bàyyi ngeen dugg ci biir foog ñu dimbale wante because soo leen ñëwatee solu leen masque raxasul leen seen loxo keneen ñëw feebar fa waat dañ koo tëjaat soo yéen ay sona rek soo nañ make sure ne ñuy déglu su ñu waxee ne nii lañ ko war a defee ñu defee ko noonu nga xam ne ñun ñëpp dinañ mun a faju yëpp dina mun a baax pour Gambia. Bintou, am I right?
Yeah, this is it. Mol fanansa kalamuta ko masakunda la nyin 1025 number wala nyinti number me alon ko mol nyanta kilila natara ya fille ko ibalo mamandi mandu ibe sobirine ko asikeno ko ye covid corona courant men fo ya fo nyame asike wala bela 1025 wala number ti nyanta men kumandila ila mobile auto ibe gamselo africell comium ibe network to ni 1025 ma doro mo nyante dankulale isine ila ibalo Kenya sato mari ni nyanta kela nyame sinafoe so sai ni kuning ni membalo mama ndiama janni be fintila kata lopita noto ibe si sabatile la suo kono le jamfa molla folo yana 1025 call isina kibaro soto ko nyanta kela nyame ani nyanta call tamandila silo menna so 1025 wala number ti mol nyanta men kolla na tara isulata purini mo e kuma ibalo Kenya la karola ani courant be banko kan hapo menna so 1025 be gamsel africell comium wala dawda qcell 1025 nyanta o number le kumandel.
Do you want me to say it in Walla?
Yeah.
Oh, have I said that? Okay. Yeah, lupin to don wax ci source moy affaire 1025 number bi government bi announced nañ ne number bi légui mu ngi dox so nekké ci sen network ci moy qcell africell comium mun nga call 1025 number bi it's accessible moy ne mun ngeen leena reach légui te 1025 number bi nak lum fa nekké moy pour ne for instance yaangi ñew nga am symptoms ci moy ne yaangi am headache or sa temperature bi mu ngi high nga feel ne daal nooy fiile foog nga ne loolu nga am xëy na covid nga am mun ngaa call 1025 te ñoom dinañ la mun a advice ñu wax la lan nga war a def waaye su dee yaa ngee feel that type of way tamit nga make sure ne isolate nga sa boppa loolu mooy ne nga sori ñoo dëkkal su dee dangaa dem nekk si benn néeg yow nga nekkaangum fa ba nga wax ak ñoom bañ la wax lan nga war a def waaye foog nga def loolu foog nga try pour protect ñoo xam ne yow ñooñu nga dëkkal si benn kër.
Yeah. There's another information I came across, but we need to verify, and it's gone public anyway, so we need to speak about it and do more verification about it.
Yeah.
It says that there was an information about outgoing travelers to the Gambia to be charged what airport officials call safety fee of $20, meaning that anybody outgoing travelers, meaning travelers leaving the Gambia going out, I believe, outgoing travelers.
Yeah,
so
yeah.
anybody leaving, it's English, that you know me, I'm saucy. So I'm not easy. Yeah, so apparently there's a safety fee of $20, which is equivalent to $100 C, and that will be requested to pay prior to checking onto your flight at departure and prior to proceeding to immigration at arrival. So this
what's
is
that $20 for? They're paying it for. They're leaving the country. These people are leaving the country, huh?
Yes.
They're not coming into the Gambia. They're leaving the country.
Well, if you understand the meaning of outgoing passengers.
Bintou, you're telling me as a person who's leaving Gambia, going out of Gambia, is paying $20 for what? What is the $20 for?
I mean, it's not really clear. That's why we need to make more verification about it.
Are they testing those people as they leave? You know,
it might be. I mean, it might be a COVID-related fees. There's lots of countries that are now applying that measure. I mean, it's either in a form of tax or it's either in a form of that will be added to the airline fees or something like that. But in one way or another, during this COVID period, there's some extra fees that have to be paid at departure or at arrival. So
as a traveler. It's not you it's not what you've said, but it's the concept that they've come up with. Because as a traveler, I'm leaving the country. You want me to pay $20 for, I don't understand. If I'm arriving and I'm coming into the country, I kind of understand that. But what is that? Why am I paying you $20 when I'm leaving the country? Are you is that going to go towards the workers in the airport? See, I'm the kind of person I like things to be very transparent. You asked me to pay $20. Let me know what the $20, where it's going to go to, and I would gladly pay you the $20.
Indeed.
You understand? But in this COVID period, when people are not working, economies are struggling, and you're asking people still who are leaving your country to pay $20 to do what? If it's going to go towards keeping the airport safe and all that type of thing, then I can understand. Because Bintou Kamara, gis nga nit ki sooy joxe sa xaalis di joxe sa xaalis si ko xam ne nekkul di la wax looy naka la sa xaalis bi di demee doo ko bëgg a jox sa xaalis. Foog nga xam naka la sa xaalis bi di demee ba pare soo demee tamit nga xam ne kii da nga ko jox xaalis ba pare yaa ngi gis naka la defee sa xaalis da nga ko dee bañ a jox xaalis. So man, I know exactly what I'm talking about.
Indeed. So we will verify this information thoroughly, and in our next live, we will bring clarity to this issue. It's very important, indeed, yes, because there's this. I mean, this information has been going around very.
Into anything else but COVID. You understand? They need to make sure that all these halis they are picking fee, because feeling togon you want 500 million and a 500 million be taken hamud nakala deme. Well, hamne nakala deme, and that was quite laughable. You know, so but we need to understand what is going on. We need to clearly understand.
It's all down to communication and information. It's all down to communication and information. And this is why this platform is here, actually, to try and bring to the public verified information and confirmed information. It's not a platform where we're going to relay any information that is actually political or anything in that sense. It's mainly to bring out verified information that can help in better preventing the COVID-19 in the country. So it's really in that sense that we're trying to verify an information, because these $20 that have been mentioned here, which is equivalent of more or less $100, it is during this COVID period that this amount has been stated. So we need to also verify what this amount is going to be used for and why the people on arrival or on departure are going to be charged this amount for.
Is it a statement that they released?
No, it's not actually a statement. It's an information that has been circulating, but I've not seen the actual official statement. But we will look into it and call the right authorities to be able to relay the accurate information regarding that story. So we will do that, and during our next live, there will be clarity regarding this $20.
Yeah, because I was just confused. Why would they want to do that? Because if I'm a traveler, and then I'm leaving the UK, and they asked me to pay £10 to leave. I don't I'm confused. So it would be good to just get some verification on that, to be honest.
Yeah, there's probably a reason for it. During this COVID period, we know some countries are doing it. There's a fee, or there's there's a tax. Yes, it's happening. There's a tax that people pay on departure or on arrival. So that's why, I mean, people are saying that now flying going forward is going to be more and more expensive, because as we go, there are more and more taxes that are being accumulated on top of the cost of the ticket, or on top of the extra taxes that have to be paid, which makes the cost of the ticket higher inevitably.
I think Fatu has just mentioned that many countries are charging COVID-19 quarantine fees.
Mm-hmm.
Yeah. So, I understand. But this is, Bintou said, these are individuals who are leaving the country, not coming into the country. So if you're leaving the country, you pay that fee. So if they're coming in, I can understand, but not going out of the country. Maybe it's just me. I don't know.
Yeah. We will verify. I mean, we will try to find out more about it and have a better discussion based on facts that we have gathered.
Yeah.
I think that's going to make the whole thing more interesting. Yes. Regarding the activities of the Red Cross, if you remember, we had discussed about an incident, I would call it that way, that happened in Bara last time, when a team from the Red Cross was denied access to the ferry. They were not allowed to cross with the ferry coming from Bara to Banjul. Yeah. That was a very strange situation that was brought forward, and we promised our followers that we would try to actually look more into the story. So we've been able to get more information in that regards, and iAfrica has also covered and tried to interview the Red Cross Secretary General about the issue. And it happened to be a fact. Some of the frontline workers from the Red Cross, actually it's the team that conducts the burial, had gone to conduct a burial in Bara. So they were on their way back to Banjul, and they had to cross the ferry, but they were denied to cross. And we believe that they probably should have had priority, but that was not the case. They were prevented from boarding the ferry from Bara to Banjul after conducting a burial. So, I mean, it's important to mention that the Red Cross has only two pickup trucks for their emergency operations for COVID-19. So that makes their work very complex if there is some COVID-19 related death announced in different parts of the country. Even if it's between Brikama and Banjul, if there's only two trucks conducting this operation,
Wow.
it can be quite challenging. So apparently, that incident has prevented the Red Cross team to conduct other burial in a timely manner. So it's very sad and unfortunate. And the Red Cross Secretary General Alassane Senghor has appealed to the authorities to really try to make sure that this type of incident don't happen going forward, because the role of the Red Cross during this COVID-19 crisis is a very major role, and it's a very crucial role that they play. Without the Red Cross around, I wonder what would happen to anybody that has died, and how these burials would be conducted, and how these preventive measures regarding taking care of a dead body would have been conducted. Just imagine. So we hope that this was an isolated incident, and this is something that is not going to happen going forward, because we can't afford to have the team of frontline workers who are risking their life by actually conducting very sensitive operation cross-country to be denied using the ferry, giving priority in using the ferry to be able to conduct their operations. So I believe that the general public would also understand that whenever they see a team of Red Cross trying to jump the queue to access the ferry, they would understand that these are the saviors. These are the people that are conducting high-risk operations in the country. And if we do not support them, we should not make their work more difficult.
Bintou, I'm sorry, through that conversation, through what you were just saying, I'm just shaking my head, because I cannot believe that the Red Cross has only 2 trucks. The Red Cross is doing an amazing job, an excellent job, right? Hana government, amuñ ay trucks, because I know loads of people aren't going to work at the moment. Amuñ ay trucks yoo xam ne mun nañ ko abal Red Cross bi ñu yokkal leen ci seen trucks yi boo xam ne gaay ko use.
Well, I mean, I think that the Red Cross mandate is a very clear one. I think that they have their own resources, and they have to be independent from the government, totally independent from the government. So far they've been conducting they have their own budget, and that's the reason why also all the operations they carry are free of charge. I mean, there's reports coming from the ground saying that some of the Red Cross members are charging families to bury the dead, and that's just rumors. The Red Cross Secretary General came out to really debunk that information, saying clearly that their operations are free of charge, and everybody should be sharing that message around, because it has to be clear to the general public that the Red Cross is not a profit-making organization that is there to collect money from families for a service rendered. The Red Cross is an organization that is running on their own funding and are carrying their operation free of charge. So just to say that the Red Cross has their budget, they have their equipment, and they conduct their activities, and it's totally dissociated from what the government is doing, even though they collaborate together and they are partners.
Bintou, I totally understand what you're saying. Everything that you've said now is totally 100% right. I understand that. But this is where it comes to the point that I made before. The Red Cross, xam nga ñoom demoon nañ to the point ba leen di wax ne ñoom their mandate is to go su leen ministre bi waxee ne am na dead body feena yéen ngeen dem foofu, you go and collect it or whatever else. But they started getting very overwhelmed because nit ñi léegi ñu ngi leen dooroon, instead of you call 1025, they were going to the Red Cross and say help, help, help. The point I'm saying is, Bintou, ñu ngi nekk si stage boo xam ne léegi things are getting very, very critical. And I know there are protocols in place and nobody wants to go against any protocol, definitely. But when the lives are at risk, and I just don't get it, because according to 5.
I think Nina's connection was just got interrupted there. We will continue still with the Red Cross. It is important to also mention to the public who might be a bit skeptical about the Red Cross when they are conducting the collection of dead bodies and how they perform the burial. It is important to mention that the Red Cross always makes it a point of duty to have their workers or volunteers discuss with the families to explain to them the process that they are going to apply when it comes to treating the dead body or when it comes to conducting the burial. So that's also very important to have that communication for the families to also know what the role of the Red Cross is and how they conduct their operation. So the Red Cross just posted on their page today that they always make it a point of duty to sit down with the family, sensitize them, and enlighten them about the process that they take regarding anything that is related to taking care of their loved one's body or the burial of those people. So yes, I think the Red Cross is doing a fantastic job, and they're also investing a lot. Yeah, and they're also investing. They're also investing a lot in their communication, which is essential during this time of crisis, this time of uncertainties, and this time where people are always very confused or not getting the right information at the right time. It's also important to have institutions in place that would really communicate with the public in a very clear way so that people are informed, and an informed population is a population that is armed to really fight to really get I mean, I don't even know how to say, because I'm getting a bit confused here with the Red Cross situation and with the burial issues that they've missed coming from Bara. It has really upset me, in fact, because I believe that we should be able to do things better. When it comes to the ferry terminal, I want to say people at the ferry terminal, the authorities that are there conducting operations at the ferry terminal should be well informed when it comes to the role of such an important institution and what the mandate of that institution is. So it's a bit worrying to see that authorities at that point were not aware of the role that the Red Cross is playing for the nation. And I hope that this is going to be addressed and corrected, really.
Yeah, the Red Cross definitely needs the support that they deserve. You know, they're doing so much. They're doing so much at the moment. You know, so yeah, they need all the support they can get.
Yeah. Thank you. Well, it just said that indeed Red Cross services are free of charge at of delivery, but the Red Cross will not deny, not take donations or subsidies from the government in this time of crisis to assist run their operations. All Red Cross services are free of charge for safe and dignified burials. I think it couldn't have been said any clearer. It's very clear. And this is what we were trying to also put across to the public, for the public to be aware of it, and for the public to know that this is what the Red Cross stands for. Selector Charles, according to Mr. Gay, he said Red Cross should have informed him before. This is a big joke with all what Red Cross is doing, putting their lives on risk. So Red Cross should have informed. Who is Mr. Gay, actually? Selector Charles, if you could just let us know who this Mr. Gay is. Because I don't believe that the Red Cross should inform the authorities at the ferry terminal that they're on their way coming. I believe that no matter anywhere in the world you see the Red Cross, a truck carrying a Red Cross on it, you instantly know that it means emergency, in which case that all cars will just go on the side to give priority to the Red Cross vehicle. This is what I've been seeing in every country I've visited in my life, and I don't think that Gambia should be an exception in that regard. Wherever a Red Cross vehicle is found, I believe that whether it's in the traffic or it's at the ferry terminal or wherever it is, the Red Cross vehicle should be given priority. They conduct very sensitive operations, and time is always is never on their side. I mean, a dead body can never wait for a second ferry or a third ferry before being buried. A dead body sitting there needs immediate attention. So, Gay at the Ports Authority. I see. Yeah. Okay. I mean, I don't think that that's a very valid point.
It would be nice to see them work quite, closely with the Red Cross, because if the Red Cross have got too many things to do with regards to they've got only 2 trucks or whatever, I think the ministry should also try and get their own trucks and try and assist the Red Cross in what they're doing.
Yeah. I mean, I'm sure that this is an issue that is going to be sorted going forward. It was a very unfortunate incident, and we really, really hope that it's not going to happen again. So you can go over the figures again, Manyenya, please.
Oh, yeah. So we have, it says here, there are confirmed cases, 2,288. There's 77 deaths and also 435 recoveries in the Gambia at the moment.
Yeah. So akamta ko banko mbetembo mento corona case be banko kanyameng jata kende abunda la ministry ya kibaro nyinfinti di jamaa kan kaetandiko mbedameng case wuli fula keme fula anin tansei nin sei wala banko kan kabrin corona datita banko kan fo kana bila mo tan woro wala ni woro wala la banta nin corona kono dolbe je ye test le wayatara corona bela ibe jara rola ina tabang dolbe je iban dingole test na take yaje ko test nin keta positivity akamta ko fananda be konto nin kono le mo tan woro wala ani woro wala wokono mo tan mo kemenani tan sabani wolle kendeyata wolle jara fo ina be kendeyata so kibarol wala be kibarol to kabo corona la dati wati folo la banko kan kana fo bila.
Bintou, if I am to say those figures in Wolof, everybody will switch off.
Well, I think we'll skip that for this time because I can't say those figures in Wolof.
I cannot say the figures in Wolof.
Well, that will be an exercise for our next live, probably. For our next live, her mission would be to learn all the numbers and how to say them properly without any mistake. Yeah, lack of coordination and communication at the ferry terminal, but I'm sure it will be sorted. Minister of Health will need to coordinate. The ferry services have their limitations, but do give priority to ambulances and emergency vehicles. Exactly. So we want to believe that this was an isolated incident and that going forward, there won't be anything like that happening again. It's very important to recognize and value each and everyone's role, the role that each and every institution, each and every individual, each and every organization is playing in the country when it comes to fighting this COVID-19. It's a collective effort. Nobody can do it on their own, be it the government, be it the Red Cross. It's a collective. It should be a chain. It should be a chain work. So it's together that we can come out with a meaningful result. If we want to do isolated actions, it's not going to work. It's not going to be effective. We need to really collaborate. New dego, nganyomwe, nganyomuta, nganyobulo muta ngakata, nganying kurang kelen na Bangkok. Wodamala be corona bailan na Bangkok. Kata bedame kurang nyin janjantale. Ajanjanta molte mala, ajantanta satul konole. ajanjantala andaɓe dame nimma hakkilotu ya fo ñame iko septembre wala ñanta kela corona la selebati akamta ko watole corona fombe futala a watoma me alon ko abe wajabila o watolla so nabe wonyama kabo sign mol nyanta ke hakilotu bakele kabo sign nyomutoni ndoku be nyanta kala kabo sign manyen na september batuna ena jahalo ena la molka ngana manna lombe be kala na nyame kabrin sign nyomo yo nyanta kala ngadoku ke nga nyomuta nga kura ngonyinkele katu namanta wonyama membe kela banko kan mo hakilo mo mallafa hakilo e tawoto
lu Bintou doon wax ci soose mooy ne fu mu nekk nii léegi lañ war a gën a teka suñ digga because first week of September bi loolu lañ predict ne foofu la peak bi di happen peak bi mooy ne foofu la jàngoro bi di gën a yokku daal so foog ñu bàyyi suñ xel ñun ñoo xam ne ay citizens lañ dañ war a bàyyi suñ xel ñu déglu loolu li nga xam ne moom la ñu ministre bi di wax mooy pour ne ñu raxas suñ loxo yi ñu sol suñ face mask yi ba pare ñu toog suñ kër yi buñ break curfew bi suñu waxee ne ñu toog suñ kër yi ba pare ñu bàyyi xale yi xel tamit ba pare tamit ngeen make sure tamit ne 1025 number bi su dee yéen yaa ngi am koo xam ne sa neighbor la xëy na moom jàngut o moom xamut affaire yi yëfi naka la nga explainal ko noonu lañ mun a defee yëfi ñu jàngalante nga wax ko ne 1025 bi su la lii ak lii ak lii dalee nga def ko nii ak nele understand nga so léegi nañ try ñu jàppale government bi tamit ñu def gaay lu ñu wax te government bi tamit ñoom tamit dinañ ñu jàppale incha allah te yëpp dina baax.
Well, I think we've covered the topics that we had come up with for this live tonight. We thank you so much for following us, and we thank you for all the questions. We're doing our best in trying to bring you always relevant information that we try to verify to the best of our ability, and to really come with substantial information to present to you and engage in meaningful exchanges, discussion, get your point of view also on board. This is what we need to do going forward, because this is the only way we can get information shared and transferred to others as well. So we thank you so much, and hopefully we'll see you, if not tomorrow, the day after. Thank you.
See you guys later.
dikluma xamal la ni jar na ko xibaar bi man la andil covid-19 mooy corona virus lépp la àdduna li ma jaaxal nag ci moom mooy xàmmeewul bu rek baatoo la tax docteur yi ci àdduna ñoom ñëpp a jóg nañu ànd ak ñun ngir yéexi leen ba jàngoro ji jóg fii ci suñu askan leen Gambia Red Cross Society ñi tey ñoom yónni woon te ma xamal leen ne wéru askan wi moo leen tax a jóg àdduna wërngal képp la doon seentu suñuy vision suñuy yaakaar ñu wekkoon ko ci yow andi looñu lu dul covid-19 yow 2020 dikluma xamal la ni jar na ko xibaar bi man la andil covid-19 mooy corona virus lépp na àdduna li ma jaaxal nag ci moom mooy xàmmeewul bu rek baadoo la ndax docteur yi ci àdduna ñoom ñëpp jóg nañu ànd ak ñun ngir International Trading Center ñoo ne ma ni ma yëgal leen ne wéru askan wi moo leen tax a jóg àdduna wërgal képp la doon séentu suñuy vision suñuy yaakaar ñu wekkoon ko ci yow andi loo ñu lu dul COVID-19 yow 2020 tas na suñu yaakaar billaay tas na suñu yaakaar déglu leen ma man ka ma joxe tegtal yi ci itu ñu raxas loxo yi mu set te ñu moytu joxante loxo set dafa wóorul wala ca moytu ndaje mbooloo dafa wóorul askan wi nañu saytu ndaw réew mi te ñu téye leen ci biir kër yi ñu bañ a génn déglu leen ma jubtal si soldaar yi ci xeex bi déglu leen ma jubtal si soldaar yi ci xeex bi Red Cross jàmbaar ngeen yéen a ngi ci xeex jàmbaar ngeen yéen a ngi ci xeex ba guddi bëccëg ngoon yéen a ngi ci xeex Red Cross jàmbaar ngeen yéen a ngi ci xeex dem ngeen xus dem yéen a ngi ci xeex Red Cross jàmbaar ngeen yéen a ngi ci xeex bi yàlla tekki ñu tiis wi yaay borom yërmande